Okay, Olivia Crosby. Do I need to spell it?
Yeah.
Okay, Olivia Crosby.
Okay, and what are you doing out here today?
I'm a volunteer here today. Dr. Rafai is one of my doctors, and when he called me and said that he wanted to hold an awareness campaign for National Kidney Day, I knew that I wanted to be a part of it. So March 8th is National Kidney Day. The month of March is National Kidney Awareness Month. Also, March 8th is Women's Health Day. So we knew we had to do something with these two events and put something together to raise awareness in our community. It's important because it's important to raise awareness on kidney diseases. 1 in 7 people actually have a kidney disease, and it's something that people don't think about. And so if we raise awareness and bring people together in the community, then we know that we could help. I'm out here today. Dr. Rafai is actually one of my doctors, and when he said that he wanted to put an awareness campaign together for kidney disease, I knew that it was important to be out here and bring awareness to the community. My story, so I actually have 2 autoimmune diseases. I'm a type 1 diabetic and I have multiple sclerosis. So health is something that I'm passionate about, and that if I could bring awareness to a healthy lifestyle, then I want to do it. Dr. Rafai has been an amazing doctor. He's a great doctor to all of his patients, and so I think that's really what motivated me. He cares about his community, and he wants people to come together and be aware of what the statistics are for kidney disease, and so that's what makes me want to be a part of this. I would tell them to come out to the walk next year. It's going to be bigger and better. This is our first annual. We put it together pretty quickly, and I know next year will be even better and even bigger. So please come out next year.
Tony Bennett, TonyBennett, and I'm the CEO of Health South Rehabilitation Hospital in Panama City, Florida. Well, I'm out here for this first annual World Kidney Day walk. It's the first event of its kind in Bay County, so we're making history today. I'm out here to support Dr. Rafai and all the great work that he does here in Panama City. I think we're so fortunate to have a doctor of his caliber here in our hometown. It's great to come out to events like this, especially on such a beautiful day, to get some fresh air, get some exercise, which is great for our health. Kidney disease is something that affects so many people and is such a life-changing disease. But if you go online to thevirtualnephrologist.com, you can go to Dr. Rafai's website and get links to information about kidney disease. And I recently read through one of his click-throughs that there's 8 major things that you can do to prevent kidney disease or improve it if you have it. And so I urge everybody to go take a look at that. Anytime that we've got events that are about people's health and bringing awareness to whether it's diabetes or kidney disease or heart disease, it's important that people support each other. And the only way to really raise awareness about what we can do to change the trajectory of our lives is to learn about it and to communicate with each other and support each other.
Brittany Cole, Brittany Cole, Director of Marketing for Gulf Coast Regional Medical Center. We wanted to come out and support all of those dealing with kidney issues or kidney disease. It's very important for Gulf Coast Regional Medical Center to be out in the community and support our patients. And we want to thank Dr. Rafai for having us out today. It's been a great walk and a great day just to, get out, view beautiful Bay County, and walk with those who deal with so much. I think it's very important to raise awareness of diseases and issues like this. I mean, many people don't know about kidney disease, and I think it's important that we get out here and get educated and like I said, support those who deal with this. I just like to come out to these events because I like to meet people. I like to see different people, meet them, hear their stories, and hear what they're dealing with. There are so many months where we deal with breast cancer or heart disease, and we don't hear much about kidneys. So I think it's important that we get out here and we hear what people have to say and what they're dealing with. Research it. Research what kidney disease is, what people deal with. Dialysis, we hear that word a lot, but we don't really know what that means, what it does to the patient, what they're going through. So I think I would go and get some research and see how you can help people and help support those who deal with this.
My name is Michael Cole, Michael.
And who are you with?
I'm with Fresenius Kidney Care here in Panama City. We're having the Kidney Day. It's basically just focusing on kidney awareness and making sure that the people that have renal disease or those that have family members that have renal disease can come get the information that they need and find out about what services are available and what opportunities are available to them in dealing with renal compromise. Well, I've been in healthcare for many, many years. I've been a practicing dietitian. I'm actually the clinical dietitian at our clinic here in Panama City, as well as the one in Definiak Springs. We have a clinic there. And I've been in healthcare for numerous years. I date myself back to '93. So I just have always loved working with patients and educating patients and making them aware of how they can better their lives from a nutritional aspect in dealing with various complications that they're dealing with. And of course, obviously with Fresenius Kidney Care, we're dealing with renal disease, renal compromise, renal loss, renal failure, and helping those patients learn how to manage their lives from a nutritional aspect in dealing with that. Oh, just public awareness in general, because people need to know what resources are out there and how to access those resources and know where to go, and information that they can glean from this is just tremendous, because a lot of times people just don't know. There's not enough, for whatever reasons, publications that are out there or notification that's out there. So this is awesome to have this event so that we can not only learn about the resources that are available ourselves, you know, with other entities, but we can also help those people that have this specific disease that can deal with that. Just basically reach out to your communities and find out about what resources are available. Come to our clinic. There's other dialysis clinics here in town that they can reach out to and get those information and that resource as well.
Shannon Vallas, V-A-L-L-A-S.
Spell the first name.
It's S-H-A-N-N-O-N. I'm Director of Community Relations at Glen Cove Health and Rehab Center. Well, this is celebration of World Kidney Day, and so our agency just came out to participate and show our support for that. At Glen Cove, we see a lot of dialysis patients, so we, want to show our support for them and, this event. Basically, I've been at Glen Cove for almost 10 years now, and I've just seen a lot of dialysis patients over the years, and we see what a taxing effort it is on them, and we just want to show our support. Just rally as a community behind these people and show support, as a community for all of our community members on dialysis. There's a Facebook page right now. Join the Facebook page and just stay involved and watch the news stations and, just kind of seek out the events.
Casey Moore, K-A-S-E-Y-M-O-O-R-E.
And what's your role out here?
I'm admissions coordinator at Glen Cove Health and Rehab.
Okay. So tell me what's going on here today.
Well, today we're coming out to learn a little bit about more awareness in our community, getting involved with kidney awareness and learning more about, dialysis patients and things like that.
Why is it important to get involved?
It's really important to get involved. I know for at Glen Cove we do have a lot of patients that, require dialysis, and it's great to come out and learn more about it.
Why do you think it's important for the community to get involved?
It's great for the community to get involved because learning more about it, the awareness, and figuring out how we can help each other, and I would definitely say obviously Facebook pages, things like that, you can find out from your local news stations. Organizations like this have different flyers to learn more about it, and they can reach out that way.
Heather Pate, Heatherpate.
And what's your role out here?
I'm a fourth-year medical student at the Alabama College of Osteopathic Medicine. So we're doing a kidney walk to support Dr. Rafai in combating kidney disease. He's a nephrologist here, and he's also our program director. He's been super supportive with us and helpful these past 2 years we've been here, and we're just showing him the support that he's given us.
Why is it important to put on events like this?
I think it's really important, especially in this area, just to educate more people in this society. There's a lot of people with kidney disease. It's so common, and so it's good to just educate everyone, get everybody out here, have a good time, and learn more about it and learn how to prevent it. Well, I'm from the Alabama College of Osteopathic Medicine. I've been here for 2 years doing my clinicals as a third and fourth year medical student. And like I said, Dr. Rafai's been our director out here. He's been so great to us and just getting us involved more in the community. It's been really fun. Well, I'm actually going into OBGYN. I grew up in Alabama. I wasn't very educated in medical field and all that, so I feel like it's really important to give back to, small towns like towns in Alabama, towns in Florida, just to kind of educate everybody on their own health and show them that anybody can do it if you have the perseverance, motivation, and just kind of show everybody to help their health out. Well, Dr. Rafai has a Facebook page called The Virtual Nephrologist, and he posts a ton of updates and just information about kidney disease and all that. That's a great resource because everybody's got Facebook these days. It's easy to read and that sort of thing. And just coming out to events like this is really great. Getting in touch with some of the hospital events, that'd be a great idea.
My name is Pamela Sledge, and I am very honored to be here today. Pamela Sledge, Pamela Sledge. My role here today is to support Dr. Rafai and his mission, and also I have a brother-in-law, Nathaniel Sledge, that he takes care of, and he has really made a difference in our life. The importance of coming out to an event like this is to make everyone aware that there is something that it is local. There is someone here in town who can help you and is willing to help you, and the resources are here for help. It's very important for me to help because just me visiting the dialysis centers, by going there to look after my brother-in-law, and knowing Dr. Rafai, all of the work that he has put into everything that he does. He's wonderful. He has done so many things. He needs to be honored for that, and also his staff and his friends. So I felt like we need to be here today to support the cause. The community should come out, participate in events like this to unite. It will help unite people in the city and the county. They just need to know, like I said before, what's out here, what the community has to offer. There are so many people that's on social media. I think they really need to turn to their social media, look at it, read it, see what's there. Even the newspapers, they need to advertise it, put it on the radios. And they need to be more aware, too, of their bodies and what kidney disease can do. I mean, it can sneak up on you. And it been for Dr. Rafai and some of the others that he works with, my brother-in-law wouldn't be here today.
Kathy Shonk, S-H-O-N-K. I'm with Fresenius Kidney Care, and we are here in support of World Kidney Day for Dr. Rafai. Today's event is to bring awareness to kidney disease and how we are all at risk at it, and hopefully try to prevent it in the future. But if you are diagnosed with kidney disease, that there are options for you. Awareness. I think kidney disease is one of those things that we think will never happen to any one of us, but when it does, it can affect your whole life. So just to make the public aware. Oh, a love of dialysis patients. So that's what my company and myself do. We take care of these patients, and once they get to stage 5 kidney disease, unfortunately dialysis becomes part of their life one way or another. So we're here to support those folks. Just make yourself aware of the different risk factors, and share those risk factors with everyone that you know. If we can prevent it, that's the key.
My name is Matthew Nordike. It's M-A-T-T-H-E-W, and last name's N-O-R-D-I-K-E. I'm a 4th-year medical student, finishing up in about a month. We're doing a walk for recognition for National Kidney Day over here to just raise awareness, especially about kidney disease. I think it's a great thing to do. A lot of people don't know they're in the early stages of kidney disease or are damaging their kidneys by what they're doing and how easy it is to correct behaviors. So we're here to just raise awareness of not only that being possible, but how easy it is to get testing done and get it checked out. I myself don't have kidney disease, but I recently, last month, did a nephrology rotation with a different nephrologist. So I'm a little bit more up to date than I was about kidney disease and damage and behaviors and what people do. So I'm just here to support Dr. Rafai and raise awareness, especially now that I'm self-conscious and know a lot about what people are doing every day to themselves. Even if it's by eating a simple food or taking an ibuprofen, you never know what you're doing. So all awareness is good awareness. I think the importance of events, even me being in med school last month, it took me to do a rotation to know. But the importance is to raising simple awareness. Like I think Dr. Rafai said it best when he said kidney disease is common and it's easily testable. If you find out you're in the early stages, you can correct it with diet, food changes, maybe a simple thing. However, most people might have it and not go to the doctor for years and years, or they do but don't get their kidney tested, and then it becomes too late. They're kind of in a place where there is damage that can't be repaired, or so they're just at a stabilization point where they try to balance what they can without worsening it and trying to make it better. So I know that's complicated, but overall, initial testing and just awareness that it is possible and common for us to tell ourselves, our friends, our families. How to get involved? I would say, first of all, what comes to my mind is think about your family members and your friends. If there's any walks like this to come to. But while you think about your loved ones or your friends, suggest that they go to their yearly doctor's appointments and maybe suggest it to their doctor if they're concerned. We all know if we're unhealthy or eat bad things that are salty, or we kind of have self-awareness about ourselves. So I'd say that's a good starting point. Go get checked out.
My name is Melissa Watford, MELISSAWATFORD. I am in support of supporting Florida Panhandle Technical College hemodialysis program. World Kidney Day, we're excited to be here. So we're touching others' lives to help touch dialysis patients. Yes, we're here from Florida Panhandle Technical College, and we are here and we want to touch the lives of dialysis patients. No, we're here to help them. We're here to touch their lives and to support them and better improve their lives. To raise awareness, yes.
A. Osama Rafai, R-I-F-A-I. Today is a special day in my heart. Today marks World Kidney Day, and it's also a National Kidney Month. We have done this event for our community for the first time. The turnout has been amazing, but the message is that get early screening for kidney disease. Early screening with a urine test, with a blood test, especially this year is for women. It's a women attention because they're at risk also for lupus kidney disease and pregnancy-related kidney disease. So I encourage every one of you to get early screening and keep on fighting for kidney disease, for early awareness, early detection, and early treatment. An event like this will really spark passion in our community and in every community, not only in the United States, but all over the world, will spark the passion about knowledge of early kidney disease, because nephrologists can make a difference, and dialysis is really a devastating illness, as well as kidney transplantation. So an event like this will raise awareness, will raise passion, will raise energy to all over the world to really talk about early detection and early management of kidney disease.
What's your story? Where did this passion come from?
Well, kidney disease is really very close to my heart. It is a very sad yet happy story in my family directly. And I became a kidney specialist, and really ever since then I have had so much professional satisfaction from looking in somebody's eyes, making a difference in their life, making a difference in their kidney disease, detection, management, control, and most importantly, keeping them away from complete kidney failure and dialysis. Just taking mere statistics, 1 out of 7 American adults have kidney disease. So it could be in your neighborhood, could be your neighbor on this side, or even in the front. So get involved, learn about it. Early detection makes a difference, and make a difference in the life of individuals. So really make an effort to learn and make an effort to really detect and see your doctor or your healthcare provider for early detection of kidney disease. My passion does not stop from making events or participating in events like this. My passion is on the web as well. Join us at the Virtual Nephrologist. Visit the website, log into the Virtual Nephrologist Facebook page or YouTube channel, or follow us on Twitter. And the reason is we update periodically very important, valuable information. It is designed for physicians, nurses, patients, family members. You will get something you like in our existence at the Virtual Nephrologist.
Candice Mayer, CandiceMayer. Facility Administrator.
For?
I manage West Beach Dialysis and Coastal Kidney Center for DaVita. We're recognizing and raising kidney awareness, hopefully to prevent kidney disease. You know, bringing some attention to lupus, hypertension, and diabetes. Well, it's important because prevention would, for most patients, would prevent them from ever having to visit one of my centers. If they were to prevent their hypertension by taking their blood pressure medicines, treat their diabetes, then they'll never come to one of our facilities. So it's important to raise awareness so they know to get preventative care. Well, our goal is for every patient that could possibly not be on dialysis to not be, or to prolong it. For some patients, unfortunately, it's not going to be, it is going to be in their future. But we want to prepare them as much as possible so that they're not afraid when they do come to our center, so that they know that they can still live a full and happy life and be a productive person at work as well as for their families. Well, we try to make it as fun as possible. Fun is one of our core values at DaVita, so we try to do fun things with our patients, and we try to keep our patients working. If they're working already, we want them to continue working. So we offer night shifts and we offer home dialysis programs all in the area, because the goal is for people to live their life to the fullest. Well, I always wanted to work in healthcare. My grandmother was a diabetic, and she started on dialysis when I was about 19. So then I got a job working for DaVita as a patient care technician, and I did that for several years, put myself through nursing school with the help of my company, and now I manage 2 facilities, and I'm able to help the patients just like they were helping my grandmother. Every time that, I guess it's every patient really, every time that they are able to have their vacations with their families, every time they're able to have the family dinners, go to church, I mean, that just makes us happy. The day-to-day simple moments are what's important, so being able to enjoy the simple moments with their families and each other, it just makes you feel good to know that you're contributing to that.
I'm Pamela Butler. Butler. Pamela is Pamela, and Butler is Butler.
What's your role here?
I'm a student at Florida Panhandle Technical College. We are attending the kidney walk to represent World Kidney, to bring awareness to the kidney disease.
Say that all in one sentence.
Now, I'm not going to be able to answer that very well, but somebody would be answer that better. But I'm here to represent. I'm here to represent kidney disease, and I wanted to walk to bring awareness to kidney disease and the people that want to help people with kidney disease. It's important because we wanted to represent our school and let them know it's a very good career, a very needful career to help people with kidney disease. And unfortunately, it's a growing disease because lots of people are getting diabetes, and that's the #1 reason that we have that disease. And hypertension is #2. My husband had a cousin who went through dialysis, and it prolonged his life and made his life longer, made him have a better life. He couldn't have lived without it, without dialysis. Well, each person is different, but the only thing that links them is their kidneys are not functioning. So as many people as there are, each person is different. They come to dialysis to have care so that they can have their blood cleaned, but that's their only common denominator. You could watch your diet, you can go and have a check to see if you have anything wrong with your kidney. It's a $10 test to check to see if there's anything going on with your health. You could eat healthy and exercise, because as I said, diabetes and hypertension are the #1 reasons they get kidney disease, but some people are born with it.
I'm Shauna Webb, SHANA-WEBB. So I am a nurse.
I just need like a title.
Nurse practitioner
But
for
what-
hypertension
are you
kidney
just a
dialysis.
vol-
I am part of the dream team.
Volunteer?
Yeah.
Okay.
So today we are recognizing World Kidney Day and International Women's Day on March the 8th, and we wanted to recognize Lynn Haven and Bay County and the Florida Panhandle for the importance of getting tested for chronic kidney disease so that we can raise awareness for our community. Well, I am a nurse practitioner with hypertension kidney dialysis specialist. I work for Dr. Rafai, and we take care of and manage persons with chronic kidney disease. So I did a clinical rotation with Dr. Rafai in the intensive care unit, and then I started working for him as a nurse, scribe, and started realizing how vast the problem of chronic kidney disease is in our community and how many people are affected, and the need for education about hypertension and diabetes. So now I manage, along with Dr. Rafai, over 50 dialysis patients in the community. So I would like everyone to know that it's easy to get tested for kidney disease, and managing their blood pressure and taking their blood pressure on a regular basis and getting tested for diabetes as well will also help prevent chronic kidney disease if you're able to manage that.